The mental status examination boot camp has been divided into 4 parts, and Part 2 will cover thought process and content.
Thought process and thought content can often be misunderstood. One helpful way to help you understand these better is to just flip the words around. When thinking about a patient's thought process, consider their process of their thoughts. This means how a patient's thoughts are being conveyed and expressed. When thinking about a patient's thought content, consider the content of their thoughts. This refers to what the patient is actually saying, including any delusions or suicidal and homicidal ideation.
A disordered thought process is defined as disorganized thinking, as demonstrated by a patient's expression and the connections of the thoughts. Thought process disorders are a historical concept in psychiatry, and there is no formal thought process disorders list in the DSM-5. In order for a disorganized thought process to qualify as a disorder, the disorganized thinking must be severe enough to impair communication with others. The DSM-5 briefly mentions disorganized thinking in the schizophrenia spectrum and other psychotic disorders section. Some terms that are used to describe disorganized thought process are listed below. Tangentiality describes a nonlinear thought process in which a patient does not answer questions appropriately. A patient may give an answer that has nothing to do with the question, or they may give other details related to the topic but without answering the question. Derailment describes an illogical shifting between topics. Sentences make sense individually but may only be loosely related to each other. There are many other types of disorganized thought processes. For example, a patient exhibiting a flight of ideas may be experiencing a manic episode. In this case, the patient's sentences may shift topics so quickly that it's difficult to follow the patient's train of thought.
If a patient is conveying their thoughts appropriately and their thought process is easy to follow, here's how you might document their thought process. If a patient's thoughts are difficult to follow due to disorganized expression of the thoughts, here is how you might document their thought process. For example, if a patient is using words that rhyme but do not necessarily make sense in the conversation, you can document this as use of clang associations. It can be helpful to include examples of what the patient actually said during the interview here as well. You can document this with quotations as shown in these examples.
Thought content is defined as the meaning or themes of what is being said. In this portion of the mental status exam, you can document either the presence or absence of specific contents of the patient's thoughts, such as hallucinations, suicidal ideation, homicidal ideation, or delusions. Here are some examples of delusions that you might document. As discussed in the schizophrenia diagnosis video, delusions are fixed, false beliefs and must be out of the patient's social and cultural norms. Bizarre delusions are delusions that cannot be true in reality. For example, a patient may believe that a force has replaced their internal organs with someone else's organs, with no scars left behind on the patient's body. On the other hand, non-bizarre delusions include situations that could potentially happen in reality, such as being poisoned. Sometimes, patients may not be forthcoming about their delusions due to past responses from others. In this case, it may be helpful to ask certain questions if you believe the patient may be experiencing delusional thought content. For example, you might ask if a patient ever feels like the TV or radio is sending special messages to them. If the answer is yes, this is a delusion or idea of reference. If a patient seems paranoid, you can ask if the patient is worried about microphones, cameras, or the government.